Do you give consent for this assessment?
Yes, I do.
Okay. So I'm going to, hi, my name's Abby. I'm going to be your nurse. We're going to be doing a postpartum assessment. I'm going to provide privacy, hand hygiene. I'm going to check your wristband, and your date of birth and your name matches the chart. So I've checked the chart, and it was a vaginal delivery, and the mom had no complications. So I have taken a full set of vitals, and those are also within normal limits. So I'm going to start with the breasts. And are you breastfeeding or bottle feeding?
Breastfeeding.
Okay. I'm going to just inspect the nipples and the areola. I don't see any cracks or bleeding. Since she's a breastfeeding mom, I'm going to palpate, and I don't feel any lumps or bumps, so everything's fine there. I'm going to now inspect your uterus. So can you shirt. So I'm going to put one hand at the end of the pubis and one hand at the umbilicus. I feel a firm, not boggy uterus. U-1 is where I find the fundus, and it's midline in the abdomen. So everything is within normal limits for the uterus. So have you been successfully able to urinate since delivery?
Yes.
Okay, and it was a normal amount?
Yes.
Okay. And then have you successfully had a bowel movement since delivery?
I have, yes.
Okay. So I'm gonna move on to lochia. So I look at the pad and I see a normal amount of lochia rubra, which is just a red discharge postpartum for mom. I'm gonna move on to episiotomy, which is just lacerations of the perineum. I don't see any lacerations. If there was, I would assess for Rita, but there is none. So now, moment sign, but we don't do that, so I'm gonna check for blood clots. And do you have any pain when I palpate?
No.
Okay. And I don't feel any heat. The lower extremities are cold body temperature. And I've noticed throughout the assessment that the mom was attached to the baby. They made eye contact. I didn't see any signs or symptoms of postpartum blues. And so there's no depression in the charts as well. And I checked prior to the assessment. The baby and the mom are RH compatible, so there's no need for Rogaine shawl.